The pilot works quite simply really. A patient will call for a home visit as they would usually. That patient is then called by one of our clinicians to triage the call. If deemed appropriate, we would then call the dedicated phone number we have for the DHU providers. The call handler will take full details and pass that through to the car where the nurses will visit the patient within 2 hours. After another hour, we'll probably receive an email stating what management and medication has been prescribed for the patient by the specialist nurse.
So the care and treatments and actions that we give when we get to the patient are an initial assessment of them. So that will be a physical assessment of the patient and also an assessment of their social circumstances. Once we've made an assessment, there'll be a number of options that we may go down. So it may be treating a urine infection, for example, so we would prescribe antibiotics and action that. It may be that the patient needs to be referred into a hospital or other sort of acute area. It may be, certainly with our role, during the daytime we're able to access other services such as social services, rapid response, so that we can at least sort of improve that package for the patient and keep them at home. We've got increased demands on GP services. We want to reduce hospital admissions because we know they're expensive and we know they're not always right for the patients.
And the default has tended to be in the past towards either dialing 999 inappropriately or turning up in A&E. But I'd like to stress that the financial angle is not the prime driver on this. The prime driver is patient quality, safety and appropriate care.
By allowing us to organise our day better, I do believe capacity has improved. The pilot's been running since April of last year and within that time we've made just under 50 referrals which have all been received positively by the patients. I think the pilot has brought a new dimension to the way that we work our day. I think that patients have benefited from an expert team of specialist nurses and I think we as a team work very well together.
Certainly from a nurse practitioner point of view, it's the same role that we would undertake for the out-of-hours service. It just has the added advantage for us during the day that we're able to go out and we can utilise such a lot of extra services.
We have worked with DHU as an out-of-hours provider since their inception, so the technology is there, but I think it must be remembered that the clinicians that are provided on this service are acting on behalf of our GPs, for our patients. And the perception I get from patients is that they see the clinicians involved in this service as being part of our practice team.
Patients are telling us that the service is working for them. We feel as a practice the service is working well for us. So I think that the benefits of the service revolutionising the way that we work on a daily basis should continue.
I was really relieved that I hadn't got to go into hospital because I really thought I would go in. Doctors are so busy, aren't they? They've no time to do what Jo did. She gave me a good examination. I've never ever had as good an examination as what she gave me. She did everything. She was marvellous. Because the doctor hadn't been, I didn't think they'd just push somebody onto me because she was so good. Oh, you must keep that going. Oh, well, yes, by gum.
GP should care about unplanned admissions because I think our overall aim should be to try and keep patient care at patients' homes as safely as possible. It's all about the right care at the right place at the right time. I have to admit, I was at first quite sceptical about using the service. However, using it just under 50 times, I've realised the benefit is not just for the practice, but also there's a great benefit for patients.
We all as clinicians have busy workloads during the day now, so using the service gives you that extra support for your patients in their homes.
It's a good service. The feedback from patients and from GPs that have utilised it has been positive. Think about the nurse practitioners involved in this scheme as being members of your own practice team, and you won't go wrong with it. So let's go on ahead with this project. It's working well, it's unique nationally, and it's there to help you as GPs.